We speak to Yoon Kim, Professor of Health Policy and Management from Seoul National University College of Medicine. And he joins us live from Seoul. Professor Kim, now superficially, the government says we will add many more students, so 2,000 more out of the 3,000 right now by 2025, admitting into medical school, so that there will be many more doctors in South Korea's healthcare system. Now, young doctors now, they're complaining of low pay, long working hours, bad working conditions. So superficially, it would look like if we give you many more colleagues, that should lighten your workload. Pay we can sort out later. Why is this not winning any kind of approval from junior doctors in South Korea?
So junior doctors are complaining about their long working hours and low pay. What they really concerned about is increasing numbers of medical doctors would be the less income for them when they finish their residency and they got a job in hospitals or open a clinic.
But, okay, clarify this for me. The 2,000 new admissions, they're not necessarily going into, I don't know, plastic surgery, dermatology, pediatrics, emergency medicine. They could go anywhere. These young doctors, they are earning what? Something like $2,000 to $3,000 a month. Whereas top doctors, say self-employed dermatologists in South Korea, they can earn in excess of hundreds of thousands of US dollars per year. So we're talking about a huge spectrum in terms of doctors, what they earn, what they do. Do these young doctors know the impact of these 2,000 more students every year on their work conditions, their pay conditions? As you suggest, if they are, it's self-interest, do they know the real impact? Is that why they are protesting?
In addition to government plan to increase the medical school quota, government also announced that they are going to regulate discretionary service, which are uncovered by our national health insurance. The Korean doctors have earned a lot of money from providing discretionary service because they can set their own price for those discretionary service. That's the real reason why junior doctors are on strike.
But we're referring to a particular sector of doctors, not the 13,000 junior, intern, resident doctors who are paid a lot less and who have no control over what happens to them at work and their pay. So you can understand why they might be unhappy with the lack of detail and clarity of the impact of this policy on them and their careers in medicine.
Yeah, but what they are really concerned about is not their current condition, including long working hours and pay. They really concerned about is their future when they finish their residency and got a job in hospitals and open a clinic. They are superficially complaining about their working conditions and pay, but that's not the real reason of their they are on strike.
All right. Even so, to get them off their strike, you're talking about health reform in South Korea, 10 trillion won, which adds up to about $7.5 billion US dollars. Now, this is to reform an entire healthcare sector. You've got 2.6 doctors per 1,000 patients. Now, that number is extraordinarily small. It took years to get there. It's going to be years to get South Korea out of this particular difficulty. Do you see this 10 trillion won actually addressing the problems in ways that might bring South Korea's health care system forward in terms of progress to care for, as we have been mentioning in this bulletin, a fast aging population?
Yeah, government want to increase the fee schedule for emergency care, pediatric care, and care for the severe patient. And simultaneously, they want to redistribute the doctors and hospitals across Korea Peninsula to address the regional disparity in access and quality of healthcare. I think 10 trillion won over 5 years is not enough to address those issues, but that would be great improvement. We can expect a great improvement from those investments.
All right. We will look out for more details on that particular reform. But right now, we are already facing impasse in these very early steps just on admissions of medical students. Do you see President Yoon Suk-yeol's administration, so far he stood very strong, very firm. Is he going to be making any kind of compromise? Will the medical associations, whether KMA or the Korean Residents Association, making any kind of concession so that both sides can reach some compromise so that they can come back to work and relieve an already stressed healthcare system?
Our government is willing to compromise all the medical care reform, except for the 2,000 increase in number of students, medical students. But the junior doctors and Korean medical associations are continuously demanding to our government cancel those increase in medical school quota. So there is a little possibility of compromise at the moment now.
So just to clarify, very little possibility of compromise, very little.
Yeah.
Oh, yeah. Thanks very much indeed. Yoon Kim, Professor of Health Policy and Management from Seoul National University College of Medicine.